Hello, and welcome to another live broadcast with MedStar Health. My name is Karen Dingle, and I'm joined today by Dr. Gary Volkell, a board-certified neurologist who is fellowship trained in movement disorders from MedStar Franklin Square Medical Center in Baltimore. April is National Parkinson's Awareness Month, and according to the Parkinson's Foundation, someone in the United States is diagnosed with Parkinson's every 6 minutes. So today we're going to take the opportunity to discuss this condition, which is one of several neurological diseases that affects movement and can cause tremors. Dr. Volkell will explain movement disorders in general, and then we'll ask a few questions specifically about Parkinson's disease. We'll talk about symptoms, diagnosis, treatment, and management of these conditions, and how you can work with your healthcare provider to find relief. So if you or someone that you're caring for has a movement disorder, you're in the right place. Give us a like, let us know you're watching, share this broadcast with your friends and family. And if you have any questions, ask them in the comments and we'll try to answer them during the broadcast. So let's meet today's guest, neurologist, Dr. Gary Volkell. He specializes in treatment for movement disorders, including Parkinson's disease, dystonia, tardive dyskinesia, chorea, Huntington's disease, tremors, tics, Tourette, restless leg syndromes, REM sleep behavior disorder, ataxia, and functional movement disorders. He also treats general neurologic concerns. Dr. Volkell went to medical school at New York College and completed his residency and fellowship at Albany Medical Center. He's a member of the American Academy of Neurology and the International Parkinson and Movement Disorder Society. So welcome, Dr. Volkell. Why don't you introduce yourself to our viewers and anything else you'd like to say about your philosophy of care or what you do here at MedStar Health?
Thanks for having me, Karen. Hi, everyone. Like Karen said, I'm Dr. Gary Volkell. I am the Director of Movement Disorders at MedStar Franklin Square Medical Center. Philosophy of care, the kinds of things that I like to do is make sure that when I see people and I'm diagnosing them with a neurologic condition or specifically a movement disorder, that we kind of review what the condition is and make sure that all the options that we can think of are available. So that way, as a team, we can make decisions together. So teamwork is sort of my philosophy for, in the clinic room and also outside, just with everyone I work with.
Yeah, that's great. Well, thanks again for joining us. We're going to get started by talking generally about movement disorders. So to put it broadly, how do you define a movement condition?
Yes, so movement disorders are kind of a subcategory of neurologic conditions. So normally when we think about why somebody would see a neurologist, they're usually seeing them for a concern that something in the nervous system isn't working well. The nervous system is divided up into all different parts, but you can kind of think of it as a few main parts, which would be the brain, the spinal cord, and then all of the nerves that come out of that. And that's the nervous system. And when somebody's having a problem with their nervous system because of an injury or it's just not working well, a neurologist is sometimes able to help. There can be a lot of different things that can go wrong with the nervous system. A headache could be a problem with the nervous system. A stroke could be, things like that. These are all things that, or seizures, these are all things that fall under neurologic problems. Movement disorders would be a category within that. To be a little technical, there's a really deep part of the brain. You have them on, the brain is kind of a mirror image of itself, a right half and a left half. And there's some really deep structures called basal ganglia. And typically when these parts of the brain have an injury or a problem to them is when most movement disorders occur. And you can kind of just think of these as little groups of brain cells that work together to really help us have normal movements. So when there's a problem there, people can get these funny and abnormal movements. And that can be a little bit tricky too, because other neurologic problems can also cause people to move or behave differently, even though they may not be a movement disorder, because maybe it's a different part of the brain that's that's been injured, causing funny movements, which may or may not be a movement disorder.
Okay. What are the most common movement disorders?
So probably the two big ones that I see the most of, the majority of, would be things like Parkinson's disease and tremor. There's a lot of different things that can cause tremor, including Parkinson's disease, but also things like essential tremor. Dystonia can cause tremor as well. And sometimes even just being under a little bit more stress, whether it's a physical stress like being sick with something like a COVID infection or a urinary tract infection, or just even emotional stress. Those are things that can cause somebody to have a tremor as well. But yeah, I would definitely say tremor and Parkinson's disease are two of the big ones that I see often.
Okay. Thank you very much. So you mentioned urinary tract infection and stress as a cause. What other causes can develop a movement disorder?
Well, so that would be for certain types of tremor.
Okay.
And most of the time, stress isn't going to cause a movement disorder, but it can certainly make not only just movement disorders worse, but any neurologic problem worse. I like to think of it as like a volume dial. One of my mentors taught it to me that way, where if you have a problem, stress is going to amplify, it's going to turn it up. So that neurologic problem is going to seem so much worse when you're under more stress. Most of the movement disorders that I take care of are things that people are born with. And they can just take a really long time before people start to have symptoms of the movement disorder. Sometimes it's genetic, which means that the person inherited it from their parents. And sometimes it's due to certain environmental exposures or things like that, where somebody worked a type of job or lived in an area where maybe there was some kind of a just thing in the environment that made them more likely to get a movement disorder. Although more commonly, it's just, unfortunately, some bad luck.
Okay. So I was going to ask you if there was anything people can do to prevent or reduce their risk of developing a movement disorder.
Sure. Well, since we talked a little bit about Parkinson's disease, because that's one of the most common things that I treat, and probably the movement disorder that's maybe the most famous in many respects, because it is common, and a lot of people know other people with Parkinson's disease. I shouldn't say this, but believe it or not, they've shown that coffee and cigarette smoking can be preventative in developing Parkinson's disease. You should not start smoking. And if you are smoking, you should try to stop, because there's a lot of health benefits that come from that. But those are just some two kind of interesting things that have been found over time that are preventative for Parkinson's disease. But truthfully, actually, one of the best things, and I know we'll talk a little bit about management later, but with a lot of these movement disorders, and especially with Parkinson's disease, aerobic exercise is actually one of the best things for, if not preventing, then at least slowing down these disease processes. Because most of the time with movement disorders, we don't have a perfect cure. We're usually talking about treatments, and sometimes they can get worse with time. So anything we can do to make it so that if it does get worse over time, we can make that slow and steady as opposed to fast. Aerobic exercise is one of the few things that we really know of that can help with that. But environmental exposures there for Parkinson's disease, there are certain types of course, now I'm can't think of the word where you pesticides. There we go. I was like, what's the thing used to treat plants? There we go.
Yeah.
Things like that. Those exposures have been shown to increase the risk of things like Parkinson's disease, and they're always looking for other things that may do it. And there's some question marks about other stuff as well.
Okay. Thank you very much. I do want to get into more questions about Parkinson's disease now. But I want to first just welcome our viewers again, especially those that just joined us. I'm here today with Dr. Gary Volkell. We're talking about movement disorders and Parkinson's disease. And if you haven't done so already, give us a like, let us know you're watching, and share this broadcast with your friends and family. We are going to get into some additional information about Parkinson's disease specifically. So, of course, if you have someone who is dealing with Parkinson's disease, or yourself, you're dealing with Parkinson's disease, please continue watching and ask your questions in the comments, and we'll ask those to Dr. Volkell. So let's talk about the differentiators between Parkinson's disease and movement disorders. How do you differentiate between the two?
Yeah, so Parkinson's disease is a type of movement disorder. With most of the movement disorders, there's a lot of overlap because we're usually talking about those groups of brain cells that I was talking about before, called the basal ganglia. Usually we're talking about some kind of injury or change in those, or maybe they just develop differently than somebody else. There's something is just not working quite as well, and that's where most movement disorders come from. Parkinson's disease is just one of them. And the way that it's distinguished from other diseases is really the symptoms that people are showing when they come in. To talk a little bit about them, there's two kind of big categories that I put the symptoms of Parkinson's disease in. There are motor symptoms, which are the symptoms that affect the way somebody moves. And then there are non-motor symptoms, which affects everything else, which I know is kind of like a pretty broad kind of thing. But the motor symptoms they're kind of classic. They're sometimes called the cardinal features. There's four big ones, and people need to have some kind of combination of these motor symptoms for us to be pretty certain that the person has Parkinson's disease. So those four motor symptoms are things like bradykinesia, which is a slowness of movement. So that can manifest in a lot of different ways. Maybe the person has a slower hand. They're maybe a little bit more fumbly, and they can't do things as quickly, like these fine motor movements that people talk, picking things, tapping their fingers or opening and closing their hands gets a little bit slower. But it can also be things like maybe the person doesn't move their face as much or adjust their posture in their chair as much. They're just not moving as much because they're a little bit slower. It can also be things like tremor, which is kind of like a rocking, kind of shaking pattern. It's classically called an oscillation, usually around a joint, where it can be a side to side, usually in a hand or a leg or a foot or an arm, something like that. Sometimes the jaw. There's also rigidity, which is like a stiffness or a tightness of the muscles, usually also around a joint. Maybe somebody's having more difficulty, not only because they're slower with their arm, but it's a little bit more rigid. So the muscles are tighter and maybe even a little bit painful. And then that fourth one is what we call gait or postural instability, which is a change in the way somebody walks or keeps their balance, where maybe before they had a normal kind of walk to them. Now they shuffle more, they take these shorter steps, or they've been falling more because they're losing their balance, and they don't feel weak and they're not tripping over things, but all of a sudden they're just losing their balance more. So those are some of those motor symptoms. There's also non-motor symptoms as well, things like constipation, mood changes, maybe becoming more depressed or anxious, losing your sense of smell, which I know it's kind of hard in the age of the COVID-19 pandemic, where unfortunately people lost their sense of smell to that as well. But also sleep disturbances and things like that. You actually mentioned another movement disorder, which is called REM, sleep behavior disorder. So REM is REM, kind of like that old band, which is short for rapid eye movement. And specifically rapid eye movement sleep, which is the part of sleep where people are dreaming, or at least having the dreams that we normally remember, the stuff with stories to them that we want to tell all of our friends about. And with REM sleep behavior disorder, normally when you're acting out your dreams, you don't move. You don't actually act. When you're dreaming, I shouldn't say acting out your dream. Normally when you're dreaming, you're not acting out your dreams. You're not moving. But with REM sleep behavior disorder, that's not working correctly. So instead, you do act out your dreams, and you punch, you kick, you call out in your sleep, you fall out of bed, you may hit whoever's sharing the bed with you, and that's something that can happen in Parkinson's disease as well. Although you don't need to have Parkinson's disease to have REM sleep behavior disorder, and vice versa. They can be two separate conditions, but it's certainly something that we look out for, because having a combination of all these things together usually gives us some really, really good clues that somebody may have Parkinson's disease.
Okay, yeah, that's a lot of different symptoms that just affect your everyday life.
Yeah.
So in terms of awareness, we talked about it being Parkinson's Awareness Month. Why do you feel that we need awareness for Parkinson's? And how do you feel that this condition impacts people's lives?
Yeah, it's a really good question. Well, I certainly, I'm glad that we're doing this to make more people aware of Parkinson's disease, because as you said, it is very common. People are getting
Yeah.
diagnosed with something like this every day. And it does affect people. It affects a lot of people in the United States too. So it's something where you're very likely to meet somebody with something like Parkinson's disease, and it's even getting portrayed in TV shows now, which is pretty neat. So I'm glad that there is more awareness. And it is important to know about it because getting diagnosed with the condition can help get treatment started earlier to improve things like quality of life for as long and as effectively as possible. Because as you pointed out, as I said, when I rattled off a list of 1,000 symptoms, or that's what it felt like, I think, these are things that do affect the way people live every day, like constipation, right? That's something that, having a normal bowel movement is something that people, can even take for granted. So, but even just being mobile and getting around and doing the things that you always did, we want to make sure that people are able to do that, for as long as possible, forever, right? So,
Yeah.
Because this is a disease that can affect that part of how the person lives, it can have a pretty big impact on their quality of life. So, if it's something you're worried about, getting seen by a neurologist or a movement disorder specialist, and then being evaluated can help with treatment and doing things that can keep people having as good a quality of life as we're able to provide, which is so important.
Yeah, of course. And thinking about what you mentioned about Parkinson's, you could have REM, sleep disorder as well. That particular situation, you could also be affecting your loved ones that are around you.
Yes.
So it's not just your own life that is impacted by Parkinson's disease, but it's your family and your friends as well. So having that awareness and ability to have conversations with your healthcare provider about how to manage it is important, not just for you, but for your loved ones as well.
I agree. It's a really good point.
Yeah. What do we know what causes Parkinson's disease? What are some of the leading theories?
Yeah, so this is a disease where this abnormal protein called alpha-synuclein, it's this protein that just gets misfolded. We use proteins for all sorts of things. They're kind of like building blocks that create all sorts of stuff in our body. You can think of them as making muscles, for example, right? If you break it down to its smallest parts, you'll see things like proteins in there. And unfortunately, with Parkinson's disease, this abnormal protein called alpha-synuclein starts to deposit all throughout the body. And when it deposits throughout the body in Parkinson's disease, it deposits in those areas we were talking about, the basal ganglia. There's a group of brain cells called the substantia nigra, where the alpha-synuclein deposits, and it kills off those brain cells. And this happens pretty slowly over the course of years. But the reason that's important is the substantia nigra is kind of like the main factory for this hormone, this chemical in the brain called dopamine. A lot of people are familiar with dopamine because people who know about things like changes in mood, that plays a big role in feeling happy, like serotonin and things like that. And dopamine has so many different jobs in our body, but one of those things is it helps us have normal movements. So in Parkinson's disease, when the brain cells that make the dopamine start to die, which is what's happening when the alpha-synuclein kind of deposits on them, people have less dopamine, and they go on to start having those symptoms of Parkinson's disease.
Wow. Okay. Well, thank you for explaining that. We did get a comment and a question from our viewers. Thank you. So I want to mention those now. This comment is from Selena. Dr. Volkell is amazing. So thank you for that comment.
Thank you,
and then
Selena.
I have a question for you. This is from Yvette. She says her husband recently developed a tremor in his hand. He had a stroke over a year ago, but didn't have the tremor. Was recently treated with a UTI and staph infection. She's wondering if that UTI could have caused the tremor he has. Any thoughts on that?
It could, and certainly a stroke can cause a tremor as well.
Okay.
Obviously, I don't have all the information, and
Yeah.
I'm not seeing your loved one today, but there's actually a lot of different reasons why people can have a tremor. We're talking a lot about Parkinson's disease because that's one of the four major symptoms that I described, one of the four major motor symptoms that I described. But even in Parkinson's disease, only 70% of people with Parkinson's disease have tremor. Some people don't have tremor who have Parkinson's disease, and certainly not everyone with tremor has Parkinson's disease. But yes, absolutely, having a lot of other medical conditions together can cause a little bit of tremor. So one of the neat things about us is our body has a normal tremor to it. Everyone's body does. It's called the physiologic tremor, just means like your body's normal tremor.
Mhm.
This one's really good. If you'd caught me earlier in the morning when I'd only had my coffee, I would hold my hand up for you and it would start to tremor a little bit.
Mhm.
Because things like caffeine and stress can make our body's normal tremor get a little bit more amplified. And certainly being under physical stress, like having a urinary tract infection, maybe in the setting of having an old stroke, or even other medical conditions, kidney problems, heart problems, things like that, that can make our body's normal tremor just a little bit more obvious. An example I also give is for like emotional stress, right? If somebody were in a car accident, they step out and they're all shaky, right? That would be your body's normal tremor. It's just a little bit enhanced. It's a little bit more exaggerated. So a lot of different reasons for somebody to have a tremor, and certainly hope that if you have questions or concerns that this tremor is here, it's not getting better, I would definitely talk to your primary care provider. If they think that and you decide that you should see a neurologist, then absolutely, a movement disorders provider is exactly the right person to see.
Perfect. Thank you very much. And thank you for that question, Yvette. Wanted to go back to Parkinson's disease questions that I have for you. Are there risk factors for Parkinson's disease?
Yeah, it's a really good question. So I know I briefly talked earlier about how some conditions are genetic, where they can be inherited. Parkinson's disease, while there are some genes that have been identified which can put somebody at a much higher risk of developing Parkinson's disease, in general, I don't usually think of it as a disease that gets passed down through families. Most of the time, it just happens to the one person, and it usually does not put their other family members, like siblings or their children, at risk of developing Parkinson's disease. There are, like I said, some environmental exposures like pesticides, which can put people at a higher risk of developing Parkinson's disease. But in general, beyond kind of those two things, there isn't much that I know of right now that puts people more at risk for developing Parkinson's disease than anyone else. That said, there are certain medicines which can make people look like they have Parkinson's disease, even though they don't. So probably if you're getting evaluated for Parkinson's disease, somebody will ask you about different medicines you may have taken in the past or may still be taking right now. Just because our body is kind of an interesting place where sometimes medicines just can mimic certain, can give you side effects that can mimic certain diseases, and Parkinson's disease is one of those.
Okay, thank you. How is Parkinson's disease diagnosed?
It's an excellent question. Because it's funny, because most of the time when we think about getting a diagnosis now, you think about maybe getting blood work, maybe getting some kind of imaging, whether it's an X-ray or an MRI or a CT scan. There's all sorts of things that you can get studied, getting your genes looked at, getting biopsies. And with Parkinson's disease, it's diagnosed, we say it's diagnosed clinically, which means when you come into the doctor's office, you tell them what's been going on about your medical history. They do a really kind of a specialized exam with you, a physical exam with you. And after that, most of the time, they're able to give you the diagnosis of Parkinson's disease. So it's made in the clinic without any additional testing most of the time. There are a few instances where things can be a little bit more confusing. Maybe somebody has another medical condition which looks a little bit like Parkinson's disease, or they're taking a medicine which can cause a side effect that makes it look like they have Parkinson's disease. So every now and then there can be a little bit of a gray area where maybe the diagnosis is not totally clear. And in those instances, there are some tests that can be done to help clarify. There's this one called a DAT scan, a DAT scan, which is only done for these circumstances when you're wondering if somebody could have Parkinson's disease or a disease related to it. That can be helpful. It's very similar to a CT scan. You get a special dye, though, in an IV, and then they put you through the scanner. There's also some skin biopsies, which can look at that funny protein I was talking about earlier called alpha-synuclein, where you go in and they take 3 very small tissue samples, like skin samples, where they do, if you've ever been to a dermatologist and they needed to remove something, it's just like that, but probably a little bit smaller. And I just saw, if anyone's seen, there was a new article recently that's talking about some more studies that are being done where maybe there'll be a third thing we can look at, where we can look at alpha-synuclein through some other testing as well, where instead of in the blood, it would be through this thing called cerebral spinal fluid, which would be through a lumbar puncture or a spinal tap, whatever you'd like to call it, which is another tool neurologists will use to look for certain conditions. But generally, it's diagnosed just in the clinic.
Okay. Thank you very much.
Welcome.
So, yeah, we've talked about a lot. We've talked about symptoms, risk factors, diagnoses, causes. So again, want to remind our viewers, if you missed anything, the replay will be available on our Facebook page. We're also going to upload this video to YouTube so you can replay back and remind yourself of the answers that were provided. I do want to talk about treatment now. Can you share with our viewers how Parkinson's disease is treated?
Absolutely. So right now, there's no cure for Parkinson's disease. It is what we call a slowly progressive disease, which means that over time it gets worse. It does so slowly, so it does not change overnight. That's pretty uncommon. And I usually say if it is changing overnight, or it seems to be changing overnight, that usually means that there's something else happening, like a urinary tract infection, like we were talking about earlier, just making everything else seem worse. But even though there's no cure for Parkinson's disease, there is treatment and a lot of different things that we do to really help improve people's quality of life so that they can feel more like how they always have felt, and keep them happy and healthy for as long as we can. And we talked earlier about how Parkinson's disease is a disease where those brain cells that make that hormone, that chemical called dopamine, those brain cells are starting to die very slowly over a long period of time. So since this is a disease where people are losing dopamine, one of the oral medicines that we give is one called carbidopa, levodopa. It's a mouthful of a word. It's a small pill, so not a mouthful of a pill. But it is a medicine that can get turned into dopamine in the body. So since it's a disease where people are losing dopamine, we give them a medicine that gives them the dopamine back. And it's 2 medicines in one. That levodopa is actually what gets turned into the dopamine. And I think of the carbidopa as like a suit of armor. It helps protect the levodopa so it gets to the brain safely. It's a pretty easy to take pill. It has very few side effects, and it typically does not interact with many other medicines. So most people do really well on a medicine like that. It often has to get adjusted over time. And there's a lot of other oral medicines that can get added on, which can either increase or help the effect of the carbidopa levodopa to sort of boost your dopamine, for example. And there's even some surgical options as well. Those would include things like an intestinal gel. So sometimes people will get a little pump of medicine, which puts the medicine directly into their gut through a surgically placed tube. There's also something called deep brain stimulation, where people will get a specialized device that goes into a certain part of their brain, and those structures called the basal ganglia that I mentioned a few times, which can help stimulate those areas and sort of act kind of like medicine, but it's a device instead. And there are other things as well. There's even a newer type of treatment called focused ultrasound, as well. So that's just kind of like a wide range from in terms of the medicines that we talk about. But probably most importantly, and I can't believe I'm saving this for last, but I mentioned earlier, would be aerobic exercise. It's the one thing we know of that can slow down the rate of disease progression with Parkinson's disease. And it will, not only that, but it helps with a lot of the other symptoms of Parkinson's disease as well. So not only does it keep the disease progressing as slowly as possible, but it can actually help with some of those other symptoms, maybe sleep disturbances or fatigue that can be associated with Parkinson's disease. It can help with that. And that I know I'm so long-winded. I apologize, Karen.
No,
That
it's
aerobic
fine.
exercise is going to be things like walking, running, using a stationary bicycle, dance, Tai Chi. There's a lot of really wonderful programs locally. So I know we're in Baltimore or just in the Baltimore County. There's a ton of areas in Baltimore County, Harford County, all over the area, all over Maryland, which offer different types of like exercise programs. These are kind of community things where people with Parkinson's disease can come. They're working with other people with Parkinson's disease to do exercise that's going to be helping them. There's no contact boxing programs. There's aquatic therapy, things like that. So there's a lot of really good stuff out there to help.
Thank you. I was actually going to ask you if you could give some examples of aerobic exercises.
Yes.
I had an idea, but thank you for running through all those different options. That sounds great, even for those that don't have Parkinson's disease, to get out and especially
Yes.
as the weather is getting warmer, getting outside and doing some walking could benefit everybody. I want to go back to you were talking about medication to help with the dopamine loss.
Mm-hmm.
We might have talked about this, but can you talk a little bit more about how losing that dopamine affects mood?
Yeah, absolutely. So dopamine, like we said, it's a hormone. It's a chemical in the brain. You have a lot of different chemicals, and they all have different jobs. They send different messages throughout the brain. Dopamine and serotonin are two of the main ones we often think about when we think about chemicals affecting our mood. In the setting of Parkinson's disease, the loss of dopamine actually causes a lot of problems. And one of those things is with less dopamine, people can have like a diminished mood. So that could be anything from feeling more depressed, feeling more anxious, maybe even having less motivation. So becoming more apathetic, we would say. Because all of the things like mood and behavior are linked together, we also know that in Parkinson's disease, people can have changes in their behavior, like loss of motivation, like apathy, like even changes in how they view the world. So there's something called psychosis, which is when your view of reality is just not kind of mixing correctly with everyone else's. So things like hallucinations can occur in Parkinson's disease, or illusions, mistaking one thing for another, or even delusions where somebody has what we call a fixed false belief. They really think that the wall behind me is bright pink or bright blue, even though it hopefully is white still. Right? Yeah. Something that everyone else knows is not correct. And that's all part of these changes in behavior that loss in dopamine can contribute to. That's also something that seeing a neurologist, a movement disorders specialist, is going to be able to help manage.
Yeah. And the aerobic exercise that we were talking about, I'm sure helps with the mood changes. The lack of motivation, it might be hard to want to do those things. So for those of you who are supporting someone or has someone in their life who is affected by Parkinson's disease, helping to get them motivated to maybe take a walk with them could be a nice tip. Get them outside, go for a bike ride with them, go to the park, whatever you can do. Because I think it was a great reminder that there is lack of motivation along with anxiety and depression, and that can affect you from just getting out of bed in the morning, right? So having that support system can help you.
Really good points.
Yeah. Let's talk about more. You talked about DBS. Can you talk about any clinical trials or any other advanced treatment options that's coming to MedStar Health in the future?
Yes. So we do some clinical trials at MedStar Franklin Square. There's a lot of MedStar sites, including things like Georgetown and Good Samaritan. So depending on which site you go to, they will have more or less clinical trials occurring. Always, if you're curious, there's a great website called clinicaltrials.gov, Gov, which you can look up a disease. It doesn't just have to be a neurologic disease, right? It could be any disease that you're curious about, and see what kind of active trials are going on. And that could mean, who's enrolling, which means who wants new people to come help out, versus what trials may be active that they're happening, but they're not maybe accepting new people at this point in time. Specifically to Franklin Square, we will be having a new clinical trial coming soon specifically for people with Parkinson's disease. To just explain a little bit about it, it's to help with some of the side effects that the medicines that we use to treat Parkinson's disease can occur. So specifically, if somebody has Parkinson's disease and they're losing dopamine in their brain, so not having enough dopamine usually means you're not moving as much as you normally did, you slow down, and we give people dopamine back with medicine like carbidopa, levodopa, so they can move normally again. But over time, as people lose more and more of those brain cells that make dopamine, people need higher and higher doses of medicines that are going to give dopamine back, and it can cause some side effects at those higher doses. And if you have too much of the medicine, too much dopamine, you move too much, right? So just like if you don't have enough, you don't move enough. If you have too much, you may move too much. And move those extra movements where people may rock or sway or twist a little bit. Kind of like if you've ever seen Michael J. Fox with his extra movements, for example, for his Parkinson's disease, people can get a little bit over medicated. And when that happens, we call those extra movements dyskinesias, and specifically one of the upcoming clinical trials coming here is looking at a medicine that may be able to help reduce those dyskinesias in people with Parkinson's disease.
That's great. Thank you very much. Let's talk a little bit more about managing your life. What advice do you have for patients who are managing Parkinson's disease? How can they live a fulfilling life? And what other tips do you have for the caregivers that know someone in their life who has Parkinson's? How can they support their loved ones?
Yeah, so those are really great questions, and probably the hardest questions to answer, right? So, this is a disease that affects quality of life, like we've been talking about. I usually say people don't die from Parkinson's disease, they die with it, because it is slowly progressive. So there's a lot of opportunity to try to help give good treatment to improve quality of life. And like I said, when this disease makes people not move as well, the medicine is to get people moving better again. And that way they can do those things like exercise, which is going to keep the disease moving really slowly. And this is not a disease that is necessarily going to make it so that people don't die the next day after they've been diagnosed with this. There's still a lot of opportunity to do all the things that people enjoy doing. And as new symptoms occur, or an old symptom may get a little bit worse, working with a doctor is going to help with trying to treat each symptom as it appears, to help keep people moving and functioning and enjoying their life just as much as they did before. I think really importantly is if somebody is a caregiver, somebody who's helping out with a loved one who has Parkinson's disease, what can they do? Because this is a disease that's going to affect them also, right? Just like most diseases do, right? It doesn't just affect the person, it affects the people that love that person. So, it's going to take a toll on caregivers as well, and just making sure that those caregivers don't get so caught up in just taking care of their loved one, but they also take care of themselves, making sure that they take a break, because sometimes taking care of somebody is like a job, right? It can be another job that somebody has. But I really like what you recommended, which is getting people motivated to walk with their loved one with Parkinson's disease.
Mhm.
So that is something that is good, not only for the person with Parkinson's disease, but the person taking care of the person with Parkinson's disease. It's a nice activity.
Yeah.
And just making sure that you're taking care of your loved one and also yourself. And there's different support groups and things like that, which can also be pretty helpful. Just make sure that if you're looking stuff up online, you're using a safe website, somewhere that's going to give you really good information. Like the Parkinson's Foundation is a great resource. There's a lot of local foundations in Maryland, like the Parkinson's Foundation of the National Capital Area, and MAPS, which I'm blanking on the full acronym. It's MAPS. I'm so sorry.
Mhm. Okay.
But those are two. That's the M is Maryland, but those are
Mhm.
two great local resources as well, with tons of information online.
Okay. Thank you very much. Yeah, I love what you said for the caregivers, making sure that you're taking care of yourself, in addition to your loved ones. And yeah, I think anything that you can do to educate yourself, whether you are a caregiver or managing Parkinson's yourself, is important, which is why we're doing this today. Um, so before I just have two more questions for you. The first is, if you can talk about the program that we have at MedStar Health. How does this program benefit patients as they are dealing with Parkinson's disease?
Yeah, so there's a lot of different, there's different movement disorders providers throughout the MedStar Health system. So I'm one of them for, MedStar Franklin Square Medical Center. And we have a system in place where when you come in, there's somebody like myself and my team who can help make a diagnosis, or at least tell you whether we think you do have it, or if we don't think you have something like Parkinson's disease. And then if you do have Parkinson's disease, making sure that you are set up with all the resources that you need to help manage that, in addition to seeing a doctor and having somebody who can help prescribe medicines and offer medical advice, like whether or not an oral medicine or a surgical approach is something that would be helpful. Also having physical resources, things that are going to help with, organizing your medicines, or knowing what to do if you ever find yourself in the hospital for something else and you also have Parkinson's disease.
Right.
Or finding local groups that help manage people with Parkinson's disease, or extra information that you have more resources at home, or exercise groups, things like that. Those are all things that anyone in a MedStar Health system who's taking care of people with movement disorders is going to be able to help set anyone who needs it up with it.
Mm-hmm. Great. Thank you very much. We talked about a lot today. I know I learned a lot. I hope our viewers did. We talked about movement disorders, particularly we spent a lot of time on Parkinson's disease, which was very informative. It's Parkinson's Disease Awareness Month. You did not hear me say that earlier. So want to encourage you to watch the replay, share this again with your friends and family. And Dr. Volkell, is there anything that you want to say to our viewers, just in terms of key takeaways? What do you want to make sure that our viewers get out of today's discussion before we wrap up?
Sounds good. Yeah. Well, certainly if you ever have a worry about a neurologic problem, reach out to a neurologist, whether that's through a referral through your primary care provider, or that there's somebody who you're interested in seeing. Even if you feel like it's a silly question, it's never wrong to ask for a little bit of help and just get checked out, right? If you're worried about having a movement disorder like Parkinson's disease, it's always appropriate to ask to see a movement disorder specialist, and seeing somebody who is trained in that can help answer the questions about, do you have something like Parkinson's disease or another movement disorder, and walk you through the steps you need in order to not only know if you have something like that, but to get treated with it and to give you the resources you need to take care of yourself.
Great. Thank you so much. And thank you to our viewers for joining us. We had a great discussion today. We appreciate your time and for all your questions. To request an appointment with Dr. Volkell or another one of our neurologists at MedStar Franklin Square, you can call 443-777-7320, or you can visit medstarhealth.org/Volkell. We'll put that in the comments so you can get that easily. Thanks again to everyone who joined us today, and especially you, Dr. Volkell. We really appreciate your time.
Thank you for having me.
Of course. Have a great day.
You too.